Now we're down to the last presentation, which is Florence Telehealth. Elizabeth, are you good? The video should start. It's okay, you just need to, there's one slide that you just advance.
Okay, if you just do next, it should. Okay. Oh, brilliant. I don't need to say anything. All right.
GP practices are struggling to maintain services. Blood pressure measurement is a major use of GP and practice nurse time. We have introduced the Florence Telehealth system to support practices and encourage patients to do home blood pressure monitoring. Florence is simple to use, but like all telehealth systems, the data are not linked to the practice systems. Clinicians can have problems accessing telehealth websites and so are reluctant to scale up telemonitoring systems. The Scale Up BP project is targeted at both patients and staff. Patients are issued with a blood pressure monitor. They are sent a text reminder to take their blood pressure at home. Patients text their reading to a website using the Florence system. For staff, DocMan reports of the readings recorded in Florence are created within NHS Lothian. Reports are reviewed by the GP or practice nurse monthly or 3-monthly. Blood pressure readings and an average are displayed in the reports. An alert is shown when the target is not met, with advice to consider intervention. This project is scaling up to widespread use of telehealth in Lothian, becoming a routine service in some practices. The University of Edinburgh is evaluating the project. The evaluation team is asking for patients' and staff views of the project. They are also finding out if routine data can be collected and used to determine changes in prescribing, in practice contact with patients, and effects on longer-term outcomes. 50 practices in Lothian have been recruited. Over 850 patients are home monitoring blood pressure and texting readings. Patients appreciate the convenience of the system. Staff value the reports delivered through routine information systems. The need for GP visits is reduced. A positive contribution is made to improving patient care in the community. Although practices have been enthusiastic about signing up to take part in the project, implementing changes to routine work in practice takes longer than we expected and needs adequate support in the initial stages.
Hello, I'm Laura Bell and I'm an assistant practitioner within NHS Lothian Weight Management Service. With the support of my team leads, I've been able to trial Florence over the last couple of years with our patients to find out if it was something our patient cohort would take on board. Could we support and encourage our patients to feel more in control of their own weight loss journey? Could we engage patients using motivational texts and prompting them to try out new habits, such as weighing themselves on a weekly basis? Could we achieve this with messages that would not offend or discriminate against our patients? Overwhelmingly, the feedback from patients was positive. The majority engaged and liked the text they received, as they previously admitted to feeling left to it from month to month. Florence lets us fill this gap easily and quickly. A patient said he was heading to get a snack and a text came through from Flo. He read it and he chose not to have the snack. All weight loss maintenance patients are invited to join Flo. Around 95% sign up. The remaining report to have no way of being weighed on an easily available scale, no mobile phone, or choose not to be involved. Our service sees massive potential using Florence, allowing us to provide the evidence-based 2-year support, reduce paperwork for clinic appointments, reduction in DNA did not attend rates, in turn allowing clinical staff to see more patients, therefore reducing waiting times. This can only benefit the patients.
Within the NHS Lothian Pulmonary Rehabilitation team, we have started to use Florence as a motivational tool. Once patients have completed the pulmonary rehabilitation programme, they have the opportunity to sign up for Florence. Our aim is for Florence to enhance engagement with self-management in people who have a chronic respiratory condition. If a patient would like to sign up, they can opt into one of two pathways. The first pathway delivers 1 text message per week, and the second pathway delivers 2 to 3 texts per week. The text messages are varied throughout a 3-month period. Examples of some of the text messages sent hope to encourage patients to exercise, think about their goals, refer to the pulmonary rehabilitation information booklet, as well as other suggestions. We are at the early stages of this programme, and only a few patients have fully completed all 3 months of the text message delivery. We have received some positive feedback so far, with comments such as good encouragement to remind me to exercise, helpful reminder to look at the information booklet, and one patient simply reported that it was very beneficial. We have had a patient who didn't find it helpful and chose to stop the text messages. The messages can be quickly stopped if a patient chooses not to receive them anymore. We aim to gather more information from our patients over the next few months to allow us to analyse more fully the benefits that flow will hopefully deliver within pulmonary rehabilitation.
Being a carer can be very rewarding, but it can also be a very challenging and lonely experience. Having a regular and substantial caring role for a loved one can have a negative impact on the carer's health and well-being and increase the risk of social isolation. At the Landfine Service, we offer support to carers of patients who are affected by progressive neurological conditions. We help carers access services from their local authority and third sector organisations, as well as assisting with issues such as benefits and access to short breaks and respite. As part of our ongoing strategy to enable positive outcomes for carers, we can offer registration with the Florence, or FLO, Carer Telehealth Service. Florence provides a means of keeping in touch with carers who have used our service but were no longer actively receiving support from a worker. Carers give consent and are enrolled by their carer support worker to Florence, which is essentially a text message-based system. The carer then receives a series of texts over 9 months, which offers reminders, motivational prompts, and relevant carer support information on a variety of issues, such as informing carers of training courses, or informing them prior to the flu season of their entitlement to a free flu vaccination from their GP. There is no charge for the service, and the carer can opt to stop receiving these texts at any time. The feedback we have received from carers has been positive. Florence can reduce feelings of isolation and prompts carers to think about their own needs during times when they are selflessly focused on providing care for their loved ones. Florence is not intended to replace support provided by carer organisations, but instead acts as a prompt to remind the carer of services and support that is available, as well as encouraging them to make time for themselves and look after their own health and well-being. For example, one carer advised me that she received a text from Florence which prompted her to contact her local carer centre to access a mindfulness course, something she had been meaning to do after initially receiving support, but did not follow up on due to the demands of a regular and substantial caring role for her husband. An area in which we are looking to develop Florence is to make the text received more relevant to the local area the carer lives in. For example, if the carer lives in East Lothian, then we will be able to add a protocol so the carer receives information and contact numbers relevant to East Lothian, and thereby enabling person-centred support.